And now we go to our feature story for you tonight. That Americans spent nearly $60 billion last year on their pets. And some of that money actually went to plastic surgery. It may sound unnecessary, but for some pets, they really need it. Our Lydia Serrani shows us how.
Hi, Ernie. We're here at the Center for Veterinarian Care on the Upper East Side, and this gorgeous, gorgeous dog is Kent. How you doing, Kent? Oh, look at him. He's just laying down and having a good time. Now, Kent here has had corrective surgery, and these type of surgeries are actually becoming more common. How you doing, boy?
Oh, hot diggity dog, diggity bone, what you do to me?
They're more than just pets. There are loved ones, family members, and like humans, they're undergoing plastic surgery.
Traditionally, human beings have plastic surgery for aesthetic reasons. We are doing alterations in facial and other tissues, but it's for therapeutic reasons.
Veterinarian Dr. Paul H. Schwartz says most abnormalities are genetic, problems often seen with purebreds, like English bulldogs who have difficulty breathing.
We do a procedure which is to take a small wedge of tissue out of the alar fold, or the edge of the nose, as a result of which we open up the nostril. It's the equivalent of an opposite Michael Jackson surgery.
This has to take the cake for drool.
Excessive drooling is also a problem, usually seen in big breeds, but there's a solution.
We can do a procedure where we adjust the lower lip fold, and what that does is it tends to retain the saliva in the mouth.
These corrective procedures don't come cheap, ranging from hundreds to thousands of dollars. According to Pet Plan data in 2011, U.S. dog owners spent $62 million on plastic surgery treatments alone. Most surgeries are done not on champion show dogs, but on household pets.
More than $1,000 for the medical tests.
As for insurance, most exclude genetic abnormalities.
Stay.
Oh. So make sure you do your research before you adopt or buy.
As for the breed with the least amount of problems, they're usually mixed breeds, also known as a mutt. Ernie, back to you.
Thank you very much for that, Lydia. And let's talk about this, okay? Because joining me right now is a New Jersey veterinarian, I should say, is Dr. Heather Loenser, and also a well-behaved bulldog. This is Kai, right?
Yes, it is.
Yeah, so good to have you here. You know, when people hear about plastic surgery for dogs, for pets, they say, well, you got to be kidding me, right? I'm sure that's the reaction you hear a lot.
They do, but they're thinking of it in the same way we think about it with people, where they're wanting to do things to make them beautiful or younger looking, but really we don't want to improve form. We want to improve function.
There you go.
We want these dogs to be able to breathe better, to see better, and not to have chronic skin infections from having extra skin folds.
So there are some real medical reasons to do this. Now, Kai needs some help. Quickly tell us what he needs.
He does. Kai needs an eye lift because he has something called a cherry eye. He needs a nose job because his nostrils are very pinched together.
This is because of the breeding?
It is. It is because these short-faced dogs are predisposed to that. And he also needs some work with his throat. He has some difficulty breathing. He snores a lot, and that can be a big deal when it comes to staying cool in the summertime.
Well, listen, you know, they spent $62 billion last year, so you can tell that people love their pets. You know that.
They do, and I'm grateful that they do.
Right, and that's why they're taking care of them. Now,
absolutely.
What other kinds of procedures are there?
Well, there's also other kinds that are truly cosmetic, like docking tails, cropping ears, to maintain more of a traditional look to certain breeds of dogs. So fortunately now there are the American Animal Hospital Association and the American Veterinary Medical Association aren't super excited about doing these cosmetic procedures that are only for looks. And so a lot of the breeds are now being allowed to go into the show ring without having their ears changed and their tails changed. So I think that's
yeah, you know, you wonder about that sometimes when you watch these shows, and these dogs are just so perfect. They're so beautiful. But
they're very well bred.
They do allow some of the surgery.
They do. They do more of the cosmetic ones. But the ones that we're talking about that Kai would benefit from,
that's different.
Again, these are ones that would make him a lot healthier, a lot more comfortable.
What should pet owners think about? What consideration should they have in mind if they're thinking about some type of surgery for their dogs? The kind of you're talking about now, medical reasons.
Absolutely. They should talk to their veterinarian and talk about what their dog's behaving like at home. home? Are they having difficulty sleeping? Not the people, but the dogs. How do they do in the summertime in the heat? Do they seem extra smelly? Do they seem to have issues seeing? And teaming up with their veterinarian, they'll be able to decide whether or not these surgeries are necessary. Because nothing comes without risk.
Heather, take a look at the screen right now. We're showing these pictures.
These are great. These are from my colleague out in California, Dr. Jeff Werber. He does a ton of these. Look at the dog with the pinched nose, and then after surgery, look how wide open that is now.
Yes, I can see that
And
very
that was done with a laser, very minimal bleeding, wasn't asleep for very long. And this dog here actually has a cleft palate, needed a cleft palate surgery, and this bulldog, his nose and his mouth connected through the roof of his mouth, so when he ate, he ended up inhaling food. And so Dr. Jeff Werber also fixed this as well, sewed it together, and now the dog can eat and drink
this really
normally.
Changes quality of life for the animal,
completely.
doesn't it? Terrific.
Longevity and health and activity level.
Dr. Heather Loenser, thank you so much for joining us today.
Thanks for
Take
having
care,
both
Kyle,
of us. We will.
Good dog. All right. There's a lot more to tell you about.